If you've been diagnosed with epithelioid mesothelioma, your doctors have probably told you that this is the best type to have, which is an odd thing to hear about a cancer that has a terrible general reputation. Still, it's true. Epithelioid mesothelioma responds better to treatment than sarcomatoid or biphasic types do, and patients with the epithelioid cell type survive longer and their outcomes are significantly better across almost every measure. Today, I want to explain exactly why epithelioid mesothelioma is more treatable and what that means for patients who've been diagnosed with this cell type. I'm Terry Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice. But understanding why your specific cell type behaves differently, it could help you make better treatment decisions. So let's start with what makes epithelioid cells different at the most basic level. Under the microscope, epithelioid mesothelioma cells, they look organized. They tend to form glandular or tubular structures. They have distinct cell borders, and while they're clearly abnormal, they still retain some of the characteristics of normal mesothelial cells. This organization is key. Epithelioid cells are more differentiated than sarcomatoid cells, meaning they still have some of the structure and function of the normal cells they came from. Cancer cells that are more differentiated, they generally behave less aggressively than cells that are poorly differentiated or undifferentiated. Think of it this way. Normal cells have specific jobs and specific structures that allow them to do those jobs. When cells become cancerous, they lose some of these normal characteristics. Epithelioid cancer cells have lost some of their normal characteristics, but not all of them. By contrast, sarcomatoid cancer cells have lost almost all of their normal characteristics, and they behave in highly chaotic, aggressive ways, and that's why they're the hardest to treat. Now, after that science lesson, I'm going to take a break here and ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, getting back to the epithelioid cell type, one of the key reasons that epithelioid mesothelioma is easier to treat than other cell types is its growth pattern. Epithelioid tumors tend to grow as more cohesive masses. Yes, they do spread, but they often form discrete tumor nodules or areas of thickening rather than infiltrating microscopically and diffusely through tissues. This cohesive growth pattern matters enormously when it comes to surgery. When it's possible to see a distinct tumor mass and remove it, surgery has a better chance of significantly reducing your tumor burden. By contrast, sarcomatoid mesothelioma tumors spread through tissues in ways that make complete or even substantial surgical removal nearly impossible. You can't remove cancer that you can't see and that's spread microscopically everywhere. For peritoneal mesothelioma specifically, this is why epithelioid type does so much better with cytoreductive surgery and HIPEC. If the surgeon can identify tumor nodules, remove them systematically from the abdomen, and then place heated chemotherapy on what's remaining, that works great. When a patient has sarcomatoid peritoneal disease, its diffuse infiltration makes this surgical approach much less effective. For pleural mesothelioma, having the epithelioid type is a factor that favors surgery when it's considered appropriate. Pleurectomy and decortication, which is removing the pleura and visible tumors while preserving the lung, it works better for epithelioid disease because the tumors can be more cleanly dissected away from the lung surface. The second major factor is chemotherapy response. Epithelioid mesothelioma responds better to chemotherapy than sarcomatoid disease does. The standard chemotherapy combination of pemetrexed plus cisplatin or carboplatin shows response rates of 30 to 40% in epithelioid disease. This means that tumors shrink or stabilize in about 1/3 to 40% of patients. In sarcomatoid disease, the responses are much lower, often under 20%. Why the difference? It relates to how differentiated the cells are. Chemotherapy drugs typically work by targeting rapidly dividing cells or by interfering with specific cellular processes. Epithelioid cells, being more similar to normal cells, they're more vulnerable to this mechanism. But sarcomatoid cells are abnormal and chaotic, and they've often developed resistance mechanisms that make chemotherapy less effective. Now, the newer immunotherapy combinations, they've changed the landscape a bit. The CheckMate 743 trial, which compared dual immunotherapy with nivolumab and ipilimumab to chemotherapy, showed that epithelioid patients did well with both treatments, but they tended to do slightly better with chemotherapy. Non-epithelioid patients, the ones with sarcomatoid or biphasic type, they actually did better with immunotherapy than with chemotherapy. This is an important finding. It's not that epithelioid disease responds better to immunotherapy than sarcomatoid does. It's that epithelioid disease responds reasonably well to both chemotherapy and immunotherapy, which gives oncologists more treatment options. Sarcomatoid disease responds poorly to chemotherapy, but somewhat better to immunotherapy. The third factor is the slower growth rate of epithelioid tumors. They're still cancer and they do grow and spread, but they generally do so more slowly than sarcomatoid tumors do. This slower growth provides more time for treatment to work and more time for second and third line therapies if initial treatment fails. It also gives treatment more time overall. Median survival statistics reflect this dramatically. Epithelioid mesothelioma has a median survival of roughly 18 to 24 months with modern treatment, and 5-year survival rates of 10 to 20% depending on stage at diagnosis and other factors. But sarcomatoid mesothelioma, its median survival is often under 12 months and frequently under 6 months. A 5-year survival, it's extremely rare. For peritoneal epithelioid mesothelioma treated with cytoreductive surgery and HIPEC at an experienced cancer center, 5-year survival rates can reach 50 to 75%. This is a completely different disease trajectory than is true of sarcomatoid peritoneal disease. The fourth factor is that epithelioid tumors may be more susceptible to immunotherapy. While the data on this is still evolving, there is evidence that the more organized structure of epithelioid tumors makes them more visible to the immune system and therefore more vulnerable to immune-mediated destruction. Another consideration is that epithelioid mesothelioma is more likely to remain localized longer before metastasizing. Sarcomatoid disease tends to spread early to lymph nodes and distant organs. Epithelioid disease, while it certainly does eventually metastasize, because it remains more localized in the early and intermediate stage, more patients are diagnosed at stages where aggressive local treatment like surgery is still a possibility. Genetic factors also play a role. Research has shown that epithelioid mesothelioma has different genetic characteristics than sarcomatoid disease. Patients who have what's called a BAP1 mutation, that's BAP1, which is a genetic change associated with better prognosis, are more likely to have epithelioid disease. The genetic profile of epithelioid tumors may make them inherently more treatable. So, what does all this mean for patients with epithelioid mesothelioma? First, if you're a candidate, you can pursue aggressive treatment. Because epithelioid disease responds to treatment better than other cell types, aggressive treatment is more likely to produce a meaningful benefit. This may include surgery if you're a surgical candidate, chemotherapy or immunotherapy for first-line treatment, and additional treatments if your disease progresses. Second, you should seek treatment at a specialized center. Effective treatments exist for epithelioid mesothelioma, so while being treated at an experienced cancer center is important for all mesothelioma patients, having access to state-of-the-art treatment can significantly impact outcomes for these patients. Third, consider clinical trials. Because epithelioid disease is more treatment responsive, novel therapies being tested in clinical trials may offer additional benefit. Fourth, maintain hope based on realistic expectations. Epithelioid mesothelioma is a serious, life-threatening disease, but it's also a disease where treatment can make a real difference, where some patients achieve longer-term survival, and where the trajectory is more favorable than for other cell types. Fifth, if you have epithelioid peritoneal mesothelioma, you should absolutely pursue evaluation for cytoreductive surgery with HIPEC at a specialized center. This is where the best outcomes in all of mesothelioma occur, with 5-year survival rates that approach those of some more common, less aggressive cancers. One important caveat: having epithelioid mesothelioma unfortunately doesn't guarantee a good outcome. Some patients with epithelioid disease progress rapidly despite treatment. Factors like stage of diagnosis, overall health, age, and individual tumor biology all influence outcomes. Epithelioid cell type improves the odds significantly, but that unfortunately doesn't provide certainty. And there are also subtypes within epithelioid mesothelioma. Well-differentiated papillary mesothelioma is a rare subtype with even better prognosis than typical epithelioid disease. Some patients with this subtype have actually been cured with surgery alone. Other variants, like deciduoid or clear cell mesothelioma, may also have different treatment and outcome characteristics. So to review, epithelioid mesothelioma is easier to treat than other cell types because the cells are more differentiated and organized. The tumors grow in more cohesive masses that can be surgically removed. The cells respond better to chemotherapy and other treatments. The growth rate is slower, which provides more time for treatment, and the disease tends to remain localized longer. All of these things combined result in longer survival and better treatment outcomes than is true of sarcomatoid or biphasic types. If you've been diagnosed with epithelioid mesothelioma, pursue aggressive, appropriate treatments at specialized centers. And visit mesothelioma.net for information about treatment options and for access to a free resource guide. If you'd like to talk to a patient advocate immediately, call 1-800-692-8608 or use the live chat feature on the website. And remember to post any questions below. As for me, I'll see you next time.